One of the things King County Medic 1 prides itself on is the save rate for witnessed VF arrest. All cardiac arrest patients are considered high risk due to aerosolized droplets from the patient during the code. All personnel within the room where the cardiac arrest is happening are considered in the hot zone. Anybody outside that room, meaning outside the building or outside the front door, are in the warm or cold zone. The idea here is to minimize the number of people that are in that room while the code is being worked. Normally in King County, we have 11 people on a cardiac arrest response. We're going to limit that to 5. The scout paramedic and his or her partner, the scout EMT, and 2 of their coworkers. Everybody that's in the hot zone on a cardiac arrest has a mask, eye protection, gown, and gloves. To minimize the amount of time not on the chest doing compressions, it's optimal to have people that are responding to attempt to have MEG on even before they get in their rig or while they're responding. We all know during cardiac arrest that sometimes additional resources are needed. Sometimes codes can be prolonged and the EMTs that are doing chest compressions lose their efficiency. So we may need to call in additional people. Maybe there's safety issues going on. So it's up to the scout EMT and the scout medic to request additional resources that are located out in the cold zone. The focus on all cardiac arrests is the assurance that we do not interrupt chest compressions and we do high quality CPR at all times, regardless of the patient and regardless of what the circumstances are behind the cardiac arrest. The emphasis on MEG throughout the resuscitation process is important because when the patient is resuscitated, it will be necessary to have that on during transport to the hospital and into the cath lab. So let's take a look at what this would look like in real life.
Our first BLS crew has arrived on scene. You will notice that all 3 crew members are wearing full MEG PPE, ensuring that the sleeves of the gown are tucked into the gloves. We want to check for a pulse like always. If there's no pulse, that first EMT will begin compressions. We have another BLS crew member that will be doing ventilations with a bag valve mask, and the third member will be setting up the AED. It's important to note with the individual doing ventilations that a HEPA filter has been applied to the BVM and that a seal is maintained at all times during compressions. The only time this would not hold true is when medics arrive and secure the airway via intubation. Okay, so we've done our first analysis and shock, no shock has been advised. You will see that we are off to the races here with our first 2-minute cycle. We do have another BLS crew arriving as always, along with 2 medics, a medical services officer, and a battalion chief. If resources are needed, we can allocate them as necessary. The reality is we will probably need at least 1 more BLS crew member to perform all the tasks necessary during a cardiac arrest scene. Once medics do arrive on scene, that'll free up the individual that's managing the AED. You will see that that officer has a dispatch saying that we do need at least 1 more BLS crew member to enter the hot zone, and here that individual arrives. That gives us 2 EMTs that can take turns performing compressions. The person that is ventilating the patient will remain at the head doing so. And then again, when medics do arrive, that will allow this other individual to perform other duties. Okay, our first 2-minute cycle has occurred. We have switched out who are doing compressions, and now we are beginning our second 2-minute cycle of CPR. Medics are now arriving on scene. You will see that they are also in full MEG PPE, just like the BLS crew members that are at the scene. That leaves us with 2 additional EMTs that are outside in the cold zone. The number 1 priorities here for these 2 medics is to secure the airway and also get an IV started for medications. And now that we have switched over from the AED to the life pack, our other BLS crew member has now been given the Doppler to check for femoral pulses. And you will see that the medic here that is going to be securing the airway, they have applied a face shield because this patient, their secretions can be aerosolized. That is one reason we want to maintain that good seal throughout. But this is not the case during intubation. We are still doing compressions, as you can see, and the medic is right there at the head doing the intubation. So that is why they want to make sure that they have that face shield on for added protection. So one of the big differences that you'll note here is that we have 6 individuals in the room rather than the full complement of 10. We typically have 6 EMT BLS crew members at a cardiac arrest scene, along with the 2 medics, the medical services officer and the battalion chief. We still have the MSO and the BC on the scene. They are just outside in the cold zone, as well as those other 2 BLS crew members. They can be called upon as resources are needed. But our goal here is to perform high performance CPR while limiting the amount of personnel being exposed to the hot zone. And we're going to go through one more transition. So we can see there that we are simply using those 2 BLS crew members for compressions. All other tasks are being managed.